Welcome to Parent Solution. Today we have here with us Dr. Christopher Willard. Welcome, Dr. Christopher.
Thank you so much. It's wonderful to be here. So nice to see you.
Yeah, thank you for being here with us. Dr. Christopher Willard is a clinical psychologist, author, speaker, and he has written 20 books and also a faculty member in Harvard Medical School. And today he is going to talk about anxiety in teenagers. So tell us more about anxiety in teenagers. How is it looking in this current world? And where are we leading? And how, as a parent, we can support? So just guide us through that.
Absolutely. One of the things that's worrisome is that we know that mental health issues among kids and teenagers in particular are going up, not just here in the US where I am, but that this is really happening all over the world, including where you are. It seems so
Yeah.
far away. And we know that anxiety in teenagers, when it's not treated, it tends to get worse and starts to turn into depression, behavioral problems, problems with drugs and alcohol or other kinds of behaviors. And so it's really important that we start to address it at a younger and younger age and give kids the skills that they need to be able to more effectively manage anxiety if they have it, to be able to support their friends and siblings and recognize it in each other if any of their friends or siblings may be struggling with anxiety, as well as give them some kind of strength-oriented skills that keep them from developing anxiety in the first place. Because what we know is that actually about a third of teenagers, at least here in the US, and I think something close to that worldwide, actually end up experiencing anxiety of some kind before they're adults. So this is far too many. And so we really do need to do something about helping our kids access, whether it's treatment or resources or skills to manage their anxiety more effectively before it turns into a bigger problem.
Yeah. And how can we come to know about it? Can you tell us about some symptoms or signs which, as a parent, we can notice that children are going through it?
Absolutely. And I think it's important to remember that we all get worried. That's a perfectly normal human reaction, that we all get anxious sometimes. But what really matters in terms of whether it becomes a problem is the anxiety then interfering with the important parts of life? And for a child or a teenager, those are the developmental things that they need to be doing when they're teenagers. So is the anxiety keeping them from going to school? This has been a big problem since the pandemic, that more and more kids are feeling anxious about attending school, whether it's because of feeling socially inadequate, or whether it's because they're feeling academically behind, or whether they're just out of practice with how to socialize with other kids. And so we want to make sure that they're not staying home, that we're gently pushing them to go to school. We want to make sure it's not interfering also with their social lives, right? Are they staying in? Are they not going out? Are they not making friends? So when anxiety is lasting for a long time, it'll start to have those negative impacts on their social life and their academic or their work life mostly. And then as far as what the symptoms look like, we want to see those. We don't want to see them, but we would need to see them for a few weeks on end. It's things like being jittery, having trouble sleeping, maybe having an upset stomach. It gets difficult to eat because your stomach feels nervous. Many of us know that feeling. Sometimes it's tension in the neck and head and shoulders, headaches, and then certainly avoiding things that make them anxious. So avoiding school, avoiding social engagements, avoiding doing work, or avoiding going out of the house at all in a more general anxiety disorder. We also see kids struggling with panic attacks and panic disorder, and that's often accompanied with racing heart, feeling hot, feeling flushed, difficulty breathing or breathing really rapidly, like, right? That's the sign often that a panic attack is coming on. And then often sort of like thoughts really shutting down, chest pain, focus being more narrowed, inability to think clearly, racing thoughts, that sort of thing. Those are what kids will talk about experiencing when they're experiencing a panic attack. It's not necessarily all of those, but it's some of those symptoms would be a panic attack. And then some of those other symptoms would be seeing anxiety in a kid and those lasting for a while and really interfering with their functioning. I mean, if you're anxious about snakes, but you don't live in a place where there's snakes, it's not really a problem, right? It's,
Yeah.
is it really impacting your behavior in a way that's negative? That's when we want to start to worry.
Okay. Well, how as a parent we can support them? What should our role be when we notice that our children are in anxiety?
Yeah, I think what we want to make sure that we're doing is being really supportive and validating of how they're feeling, although we don't want to necessarily validate what the worry is. So we might want to
Okay.
say to a child, it sounds like you're feeling really worried about school. It sounds like you're feeling like you don't have any friends. It sounds like you're feeling like you're worried about the test. Once we make
Okay.
that connection, then we're doing what's called co-regulating with the child, where our nervous system and their nervous system are kind of in sync and connected with each other. And at that point, after we're connected, then maybe we want to start to have a conversation. What is it that you're really worried about? How did you do on the test last time? Remind them that they do have those friends in school, or remind them why their anxiety might be taking over in a way that's maybe inaccurate to what the actual situation is. So we need to really start by just validating you're feeling that way, but not validating it's true, you don't have any friends, or immediately arguing, no, you do have a lot of friends, everyone loves you. Neither of those is going to get through when the child's really agitated in that moment. So staying calm ourselves, helping them to calm themselves down emotionally and physically, maybe some deep breaths or listening to music or something like that. And then having that connection around, let's think through, is that actually accurate? Do you really have no friends? Like that's really an example of black and white thinking.
Okay. That's a big one. Thank you for sharing that with us. And one last question, as I want to keep it really short and laser for our viewers to watch it. Give us few tips how to handle anxiety in teenagers.
For teenagers, I think what's important is to give them the skills that they need, and I think to talk to them about what the anxiety looks like. Cognitive behavioral therapy teaches us about what are called thinking errors or cognitive errors. So it's explaining black and white thinking means seeing things as all one way or all another way. Another thinking error is catastrophizing, right? Taking a small thing, right? I missed one thing on the test and deciding it's a catastrophe. I failed the test. Now I'm going to fail out of school and never get a job again. Mind reading, right? I think, the teacher hates me. I know that they're out to get me. My friends are talking about me, right? Imagining things that are true that are not true or just based on not enough evidence. So you can even just as a parent, even just Google what are common thinking errors related to anxiety and talk some of those through with your child or adolescent, because they'll be able to recognize themselves or recognize their friends as struggling with these particular thinking errors. And that feels really empowering for kids to feel like, oh, I recognize what this is. This is my anxiety. This isn't me. I can maybe even help my friend who's struggling with anxiety because they're catastrophizing or they're having instance of black and white thinking. And then when they recognize it in each other and in themselves, then they can start to kind of see their anxiety for what it is, which is just an inaccurate reflection of the world around them, and maybe make a different choice. What's really important as parents is that we give those kids the opportunity that we push them to still do what's difficult. I know you don't want to go to school. I know that you're scared of your teacher, but it's still important that you go or that you try going. And maybe you can give me a call, when you're in school, but you still need to go. You still need to go out with your friends. You need to go to this event, right? We can talk when we're there about whether we want to change or you need a break once you're there, but it's important that you go and not hold them back from doing things, because otherwise the anxiety actually gets worse the more we avoid the situation. And that's a lesson that we know from neuroscience, and it's a lesson that every culture and spiritual tradition in the world tells us, that we do need to face our fears.
Okay. Thank you for giving us that tips. And I will guide all my viewers to go through Dr. Christopher's website and look into his work, and which I'll be putting in the description box. Thank you for being here with us.
Thank you so much, Filza. Thank you for having me.
Yeah.